Welcome to the Global Integral Beauty Networking event, an innovative platform that seeks the best professionals from the global industry to connect and build an interdisciplinary community working together for the benefit of patients. Hosted by Adalis Bailey, global leader in the integral beauty field, a registered nurse with an MBA in marketing, skincare specialist, and CEO of Renew Aesthetics. Adalis Beauty Savvy and Global Integral Beauty, also a best-selling author. This is a revolutionary opportunity to create professional networks in the fields of health, wellness, and aesthetics, driving global collaboration. Get ready to enjoy an event full of connections, knowledge, and innovation. Welcome to the Global Integral Beauty Networking.
Good afternoon, everyone. Thank you to be here in this special event. This is our networking monthly event. We do two, one in English and one in Spanish. Yesterday we have the same topic, but we all the professional in Spanish. Our topic today is going to be anti-aging, nutrition, and hair health. The general question is the same for everyone. In this context of integrative anti-aging care, how can we effectively combine advanced aesthetic medicine, holistic nutrition, surgical precision, and regulatory compliance to achieve sustainable results and skin rejuvenation, hair restoration, and overhaul patients? So how you can do it with your experience from your area?
Well, with my experience, and, my knowledge and expertise, I would offer to support Maria's skin journey through non-invasive and supportive aesthetic therapies, respecting her age and aiming for natural, rejuvenated results. And I would offer her facial rejuvenation for skin firmness, tone, texture. And one of them would be a collagen stimulating facial treatment such as microneedling, which indicates for fine lines, skin elasticity, and texture. And it also boosts collagen naturally. And also PRP treatments. I can also suggest her to pair it up with LED treatment, red light, which is particularly beneficial for aging skin. And it also helps inflammation in the body, and infrared light for Maria's scalp issues. That's going to help her tremendously to rejuvenate her scalp, skin on the scalp, and hair growth. And I would pair it up with chemical peels, from light to medium strength chemical peels, and of course microcurrent, which is great for eye area and jowls area as well, and helps with skin tightening.
So I would focus on the whole food diet. I would eliminate all processed sugars, gluten, processed foods, and focus on something that gives you enough protein. I would want her to focus on about 1.2 grams per kilogram of protein a day. And I would focus on her liver. So considering her age, 58, that is when a lot of women actually, we have a lot of estrogen, and we want to focus on getting rid of that estrogen. So we want to focus on the liver, focus on elimination. I know that she's having some digestive issues. So I would recommend stuff like triphala and digestive enzymes, HCl, all of those to help her with digestion. We can get into other stuff like supplements and whatnot, but I always recommend to talk to your doctor and see what type of blood work you would need. So we would want to see if there's any inflammation, how is her liver working, what is her level of vitamin D, magnesium, all that stuff we would have to consider before we jump into supplements, and do consider those. I would also recommend to drink red clover tea. So red clover tea is good for any age, for any woman. It balances out your hormones, and that's something she should consider. I would focus on that as well. There's so many things that I would want to talk about, but I feel like my time can be limited. So I will let other ones speak, and then we can get into this further.
So I think when I think about a case like this and hearing from Karina and Sasha, their recommendations, right? So kind of leaning on the providers and what their recommendations would be, it would seem to me, just based on the symptoms, right, or the clinical goals that we're talking about, that there are three main things I would kind of focus on in a case like this. For supporting compliance for the provider and the patient, right? The first one is scope of practice, because I think I see room for injectables potentially in this case, room for maybe hormone replacement therapy, also non-ablative and non-invasive procedures like Karina mentioned, and also Sasha's work. So all of these different areas are going to have different scopes of practice in terms of what the providers can do for the client. And that kind of brings me to the second point, is making sure that in this process, if there's any transfer of patient records or information, that we're respecting HIPAA if it's applicable, but also patient privacy regulations when they vary state by state, so any transference of information. And then the third thing I would kind of focus on, and I think that some of the other providers can speak to this as well, but is any federal involvement in terms of FDA regulation, if we're talking about off-label, on-label treatments, but also maybe treatments that are marketed as wellness procedures and they're not FDA approved. So things like peptides that might be wellness and kind of just off the spectrum. Yeah. So definitely there's a lot to go into there, but I'll stop there for now.
You know, my patient go ahead and have all these recommendations done. This will only make her, which is what I do, injectables, much more better for her, much more long lasting. And it's just a whole teamwork. And I agree with every single one of their points. Absolutely important. And I do agree with going the non-invasive route, especially given the age and history and everything, and starting with Botox, maybe some filler. I would definitely have sculpture for her, a biostimulator, because that will only enhance collagen and elastin down the road. But PRP, I'm here for it. I would never say no to that, provided everything else is good in the blood work. And it's a very, very teamwork, and I love that approach that you've created here at Dallas. Thank you.